The most common type of Alzheimer's disease usually begins after the age of 65, called late onset Alzheimer's disease. There are certain genes that can increase your risk of developing Alzheimer's. There are genes that can make it likely to get it, as well as genes that solidify it. Here are some of the genes that are affected. First, the APOE2 is the least likely, and it reduces your risk of getting Alzheimer's. The APOE4, which is slightly more common, and it increases your risk of getting Alzheimer's and also increases your risk of getting a worse variant. And then APOE3, which is the most common, but it has no effect.
The 23andMe test is solely looking to identify the E4 allele that indicated late onset Alzheimer's. It only tests for this, one, because this is the one of the leading causes that is said to identify late onset Alzheimer's. It's a protein that is called alipoprotein E that results from the E4 allele. And what this does is that the E4 allele encodes for significantly less production of this protein. It affects the liver and brain cells that this protein is made in, and it does make sense that it would change the expression because it allows for the blood to form clots and plaque buildup due to the inhibited blood flow, which can also inhibit brain function. And this leads me to the major limitation of the 23andMe test, is that it is only testing this one allele. And that's why we crossed it out, because it only tests the one. And so this one allele is the main cause of late onset Alzheimer's, which excludes thousands of patients, which according to Indiana University School of Medicine is about 5% of people who don't suffer from late onset Alzheimer's, and instead they suffer from early onset Alzheimer's. So due to this, it does not test for all known alleles or variations, and does not test for all known genes. In fact, it has even faced lots of criticism for this. So this is the early onset Alzheimer's disease, the 5%.
All right, so there are around 101 associated SNPs that are associated with Alzheimer's, and only one is tested by 23andMe, which is the RS1799724. So that's in the APOE gene that we just talked about. But if we come over here to the APP gene, which is the amyloid precursor protein, it is the beta A4 variant, and it's at protein position 717 right here. And it's going to take this valine and it's going to swap it around with isoleucine, and it changes the entire protein structure. And this protein is limited to your brain function, which is developed in early onset Alzheimer's. And then there's a study from Medline Plus Genetics that states that this protein is found in many tissues and organs, including the brain and spinal cord. So the brain and spinal cord, which is the central nervous system. Central nervous. And this goes completely untested, which is what our test will test for. It's going to test specifically for the beta A4, which has the most direct link with early onset Alzheimer's, and the risk goes up a substantial amount if you have this variant. All right, the benefits of the APP gene variant is that it tests for early onset Alzheimer's, and we see in an article from Mayo Clinic, it states that anyone who gets one of these genes from either parent is likely to get Alzheimer's symptoms before age 65. The genes are APP, PSEN1, PSEN2. And that would help to help catch it early and take preventive measures and see if you want to pass it on to any kind of future generations.
As for the limitations of our test, it will be minor genetic factors without much evidence and environmental features that are excluded. We will brief the patients that there are certain SNPs and protein variations that cause Alzheimer's, but do not carry significant enough results or increased risk factor to include it in the test. For example, according to the National Institute of Health, the APOE4 allele slightly increases your risk to have an increased chance of Alzheimer's, but not only do only 2 to 3% of patients have this, but there is also another protein labeled R251G that counteracts the effects of this APOE4 allele. The other factors that might contribute will be other pre-existing conditions, history of heart disease, diet, and medical access. And these will have also significant roles to minor roles depending on a case-by-case basis. And finally, the base rate of developing Alzheimer's is about 10.9%. The rate if you have the APOE4 allele is 40% and 60% with 2 copies. Then the rate with the APP is close to around 30%.
Being tested for anything life-changing is scary no matter what it is. It can really have an emotional toll on people knowing that their memories are going to fade away. It can also be detrimental to their financial state because someone with Alzheimer's should be looked after and cared for. It could also cause depression, which of course is not something that you want.